In today's Pet Advice, we're talking treatment for seasonal allergies. Dr. Travis Gratton with University Veterinary Care Center is now joining us live by Skype. Good morning, Dr. Gratton.
Good morning.
Well, unfortunately, our pets can't tell us when their allergies are bothering them. So let's start with some signs that our pets may be suffering with allergies.
Yeah, and certainly on beautiful weather like we've had for the last few weeks, the trees are pollinating, the grasses are just beginning. Certainly the most common problem we get with dogs, unlike us being upper respiratory problems, dogs get skin problems. Itchy ears, itchy feet, the tail base is mostly just itching, licking, chewing excessively.
And what are some of the treatments that are available for our pets?
Well, historically, we've kind of always been limited to the topical therapies, shampoos, lotions, creams, and that kind of stuff, which help but had to be applied real regularly or were rather inconvenient as far as bathing goes. Antihistamines, which also kind of work, they help, but often aren't quite enough. And then, of course, there was products like prednisone and other corticosteroids, which worked very effectively, but came with a long list of potential problems and complications. So,
are there other treatments that are now available, newer treatments?
Yeah, some of the newer pharmaceuticals that have come out, much more targeted therapy. So instead of just suppressing the entire immune response like the steroids did, they actually are picking specific molecules out of the inflammatory cascade and shutting down the itch at its source. And there's both oral tablet forms that can be given on a daily basis, and there's a newer product that's an injection that lasts for 1 to 2 months, and really amazing, and with very few side effects, certainly much less than we had with all the older corticosteroid class of drugs.
Now, is that shot something that you take your pet to the vet to get, or is it something you can do at home?
That one's at home. For years also, certainly we did allergy injections, just like a lot of people who had hyposensitization injections where they would inject antigens in under the skin on a regular basis, weekly and then monthly. That has changed in the last few years now too. So instead of doing injections at home repeatedly over weeks and months for years, most companies have now switched to oral drops, which has made it so much more convenient and safer for everybody involved to try to get the animal to minimize their reaction to the allergens, to start to ignore them like they're supposed to.
Well, what are the allergens that cause the most issues for our pets?
Typically the same ones we see. We're getting out of tree season, like I said. Some of the trees are still pollinating. We'll move into the grasses, which don't tend to be as bad for most animals. But come fall, we're going to hit the ragweed and the goldenrod and all the other weed pollens. The other one that's been a big problem outside this time of year, and we see them really high in the fall, is mold pollens. When we get these cool mornings with the moisture, and you can often even smell the mold, and that can be a big trigger for a lot of animals.
All right, Dr. Gratton, thank you for being with us this morning. And if you'd like more information about University Veterinary Care Center, just head over to universityvetcare.com.